The Productivity Commission is calling for a radical shake-up of the aged care sector. It's recommending the federal government scrap the cap on the number of aged care places and remove the distinction between low and high-level care. In a draft report, the Commission also says seniors who can afford to pay more for their own care should. Aged care providers say it should give Australians more choice.
Complex, inefficient and full of inequities. That's the verdict from the Productivity Commission on Australia's aged care system.
It is not well positioned to provide quality care and support for older Australians today, and it's certainly not well positioned to deal with the growth in demand that we're going to see in coming years as the population ages.
The Commission is calling for a gradual deregulation of the number of aged care places until all limits are removed.
I hope that if we move to a more market-driven model with very serious safety net arrangements for vulnerable Australians, that the market will actually level out supply and demand, and I think that will happen.
The Commission's draft report also recommends standardising co-contributions, making the wealthiest Australians pay up to 25% of the cost of their care. Assets like the family home would also be included in income assessments. The Commission suggests the government offer loans against the value of someone's home or a new pensioners bond to quarantine the money made from the sale of a home.
The outcome of the recommendations of this report will be that less people will be, quote, forced to sell their family home than is the case at the moment.
But not everyone is happy. The report says workforce shortages are exacerbated by lower wages and difficult conditions. But the Nursing Federation says the Commission's ignored key workforce issues like minimum care hours and licensing for all workers. The government says it will take some time for the final recommendations to be put in place.
This government has had ample opportunity to undertake reform in this sector, and so yes, in this year of delivery and decision making, we would like to see some delivery.
Public hearings will be held for residents, unions and aged care providers to comment on the draft before the final report is handed to the government in June. Naomi Woodley, ABC News, Canberra.